So we are here tonight to give you an update. This is the last week of our first semester. So this is good timing for us to check in, to look at some of the data and the metrics that we monitor daily in terms of COVID and internal staff absences and cases internally, but then to also look at some of the preventative measures and check in on some of the adjustments that we've made as we've watched what's happened out in our community. The yin-yang of this relationship that we have where we watch what's happening nationally, in the state, regionally, and then in the county, but then we also have to translate that into what's actually happening day to day in our schools and carefully monitoring what do case rates look like in our schools, what do staff absences look like, to make the day-to-day decisions on keeping our schools open or making adjustments in terms of learning conditions that happen day to day for us. So we're going to talk through that tonight. Our safety team members are still very intact. The team that has been leading us, Deborah Folk obviously is a key player in keeping us engaged all the time with our health experts in this county. And the Educational Service Center also helps coordinate across districts in this region so that we understand what's happening not just in our district, but in others as well. So starting just at this big picture national lens, and this is not anything new for all of you, that when you look at the CDC national community transmission in the United States, it is very red in that upper right map, and that widespread community spread, because the Omicron variant is so much more contagious, that is happening across our country. And certainly then, when you translate that here in Summit County, we are also at that high transmission rate. And when the county says this is a high transmission county, the emphasis on the masks, everyone should wear a mask in public school settings. We're fortunate that we didn't have to go back and forth like many districts, that we have stayed, due to your leadership, very consistent, which makes it much easier on the students and the families to stay in a nice rhythm. So but we're even pushing the compliance and enforcement and kind of dedication to quality mask wearing even more. And you're going to see that in the presentation tonight. And then on the left-hand side, the positivity rate's a 7-day average, just to give you a sense. This was through December 27th of counties in this area as well, on where we fall compared to the other counties. There recently was an important study that I just want to highlight for you because it was one of the first studies in the country that actually happened right here in our back door at Case Western Reserve, to look at the level of severity of illness with the Omicron variant versus the Delta variant. And although the increase has been significant and that positivity rate has been significant, I guess if it's hard to say good news, but I guess the good news is that the study in Case Western Reserve found that this variant is milder than the Delta variant, resulting in significantly less severe illness. Fortunately, in this study, they also looked at age of folks who had gotten COVID, and the similar results, that there was a milder, this variant is milder with less severe illness. So within that context then, the decision-making for us here in Akron day to day, and when you think about the national level, statewide, what's happening, and then even regionally in this area, there really has been a shift in how we think about making changes in our learning conditions day to day. When this all first started, with some of you who are in this room all together, we were making decisions without a lot of information because we were experiencing the COVID infections, and we were trying to listen almost minute to minute on what the researchers and the scientists were learning. Now we know so much more about the prevention strategies and about how the COVID variants are spreading. We understand what needs to happen within just our rituals and routines that our students do through the day. There's so much more that we know that we feel better equipped to make decisions day to day because of that. Our goal, and this has been stated by our president, our governor, superintendents everywhere, our goal, and our president of the board, I mean, everyone has said, you just said that in your opening statements. Our student board member just talked about the importance of being in school and the differences. I think we all have seen the negative effects of what happened when we were remote on not just student learning. I actually am more concerned about the social emotional needs and the wraparound support. A lot of what Mr. Griffin talked about tonight in his comments, which were just perfect timing. We didn't even plan that tonight. So our goal is to remain open with temporary adjustments as needed. The unit of thinking is very small now, where we're looking at what's happening in a building, what's happening with classes, what's happening with schools, versus what's happening district-wide necessarily, because the differences are so significant on what can happen in one school based on positive COVID rates, based on staff absences, student absences, that the unit, we used to really only think about the district. Now it's much more nuanced that we look at school by school decisions. And within the schools, what do we need to do to modify while we're watching the data in the county and in our district? So things like we could make adjustments in field trips, in events, in how often we bring students together. There's other types of factors that we can start to modify and shift to help keep our schools open and students learning. And so those are sort of the nuanced decisions. Governor DeWine here, also just recently, just a week ago, re-emphasized this notion that I think we should go back and look at what pediatricians have told us and what children's hospitals have said, that we need, they have all said kids need to be safely in schools. And so that continues to be our goal. Before we actually start looking then at the data that we look at on a daily basis, and this is sort of the dynamic team here that we look from the operations and the academic, it's a combined effort that we have to look at this. The Centers for Disease Control has also compiled dozens of studies that show that schools can be some of the safest places in terms of COVID. Again, a year and a half, 2 years ago, we didn't have this type of data and researched, and now we do. So that helps for us to be able to rely on the research. When you think of all the prevention that happens in the schools, sometimes that's much more robust than what's happening out in the community. And there's some of the data that you'll see some of that influence of what happens when students return to school. So the data that we monitor daily to determine if any temporary adjustments are needed, meaning temporary event closures. If we did need to go to remote, it may just be for a few days instead of months and months and months. We look at the data daily, and we look at it in the same way that we've look at the Summit County Public Health. They report their data on their weekly reports. They code it as decreasing, sustaining, or increasing. So that's what we're watching for, our trends. And the first three are county COVID positivity rate for adults and children, county new case rate for adults and children, vaccination rates for adults and children, and then staff and student COVID active case rate. So the first three are, here's what's happening in the county, and then the fourth one, you get into the Akron Public Schools, looking at our dashboard that is public on our website that shows our staff and student COVID active case rates, and we're gonna dive into each one of these. I bolded the last three because these are the keys. Because a lot of what, particularly for whether we need to make a decision going into remote, a lot of the decisions, and this is what all of our colleagues are saying across this county and across the region when we talk at the Northeast Ohio ESC, that the staff absences are probably the major reason if a school needs to go remote because of staffing shortages. And that, we just asked, we had a meeting this morning with the staff from Summit County Public Health, and we asked if any school had to close in this region for any other reason. And she said no. She said there might have been one school that had another reason because of some spread that they closed a class, but otherwise it's all been because of staff shortages. So that one is probably the most important, that staff absence for the next 5 days and trends. And then student absence trends. And then an interesting one is operations, supply chain, and distribution. There have been moments when we have had to huddle about some food distribution issues where the concern is, would we have all the deliveries we need? Or will we have the deliveries of masks when we need them? Or will we have, so that is a concern that we have to monitor on a daily basis. So I'm gonna have Deborah now come up, and we're gonna tag team the rest of the presentation where she will share the data points and any of the information that she gathers from the Summit County Public Health. And then I'm going to talk about how it translates then to our decisions that I bring to the superintendent about any hot spots that are happening with the school.
Good evening. Nice to see you all this evening. Thank you for having us. The positivity rates usually come out on Thursday afternoon from Summit County. And I wanted to share with you the most recent 3 weeks because, as you all are aware, we've had the holiday season, and we've also had a different change in the type of variant that's going through. First it was Alpha, then it was Delta, which was very severe illness, but not necessarily spread as much as Omicron. So as you can see, in mid-December, the county was at 22.8%, and this is everybody, ages young to old, and then it did increase to 30% just around the Christmas time. So what this really kind of does reflect is you saw Thanksgiving happen, you then got through some positivity after Thanksgiving. This is the end of that positivity. And then once we got beyond Christmas, we went to 34.2% for that last week of December through January 1st. So therefore, that is important for us to keep a very careful eye on as we try to determine, as Dr. McWilliams-Wood said, is it increasing, is it sustaining, or is it decreasing? So we always make sure that we look at these. The second item that I wanted to share with you was absolutely telling piece of information off of Summit County website, and this is from December 27th through January 9th. The total cases in Summit County were 14,576. This is an increase in cases, but what's interesting to us as we looked at this was the age of the COVID cases in the block listing next to it. As you can see, from ages 0 to just under 18, those positivity rates are very low. And that actually reflects well when you are putting students into schools because they do not tend to be the spreaders of this disease. But if you got slightly older, from 19 through 59, that is where the spread is occurring. This is our staff members, which is why we monitor this particularly well and very actively on a daily basis through our absences and the recording of information. So we wanted you to see that students are safe when they are with us as long as we have staff that can service them in an equal format across a classroom, a building, as well as the district. The next one is kind of interesting. This is a comparison of the month of December. And I wanted you to see this because the individual colors, white is very, very low case rates. As it goes through the blue spectrum, it then gets into the kind of magenta and the red, with the red being the highest spread. Now, this is an individual day rate of cases, confirmed and probable. But please look at ages 18 and under, which is mostly blue, with one very large red day, which happens to be the 28th of December. Welcome to the celebration of Christmas with family. But then look again at the ages of 18 to 64. Please remember that in those yellow boxes, beginning on December the 18th going forward, this was winter break. This is when students were not in our school buildings, but were at home, being with family and friends. And we noticed that as we looked and compared these two relegated groups, very high spread among the adults just after Christmas going into the New Year's weekend. So we had been monitoring those, even though this was winter break, this was still something we were actively looking at. And this resulted in the decision to make sure that we could go ahead and test our staff or offer tests to them the Sunday of New Year's weekend. So we tried to make sure that we were following up with that as well. This actually is a snapshot of our dashboard. And for those of you who have been out on the dashboard, it does list the total number of student and staff cases for the 21-22 school year beginning July 1. It is the active cases that are really the cases that are truly somebody is homesick, somebody cannot come to school or report to work. And then we also are monitoring the other information by building. As of this morning, we had active cases for students at 137, which is 0.7% of our student enrollment. We had active cases of 144 staff adults, which is just coincidentally happens to be 0.7 of our staff. And I will tell you, when we took this snapshot after we had met this morning, we were back into the dashboard later this afternoon because of a number of cases that are now closed, meaning they have reported back to school and back to work, and we are down to 79 positive staff cases later today. Now this is a fluctuating daily update to this particular very piece of important information. And then subsequent below that, we have each building listed for students and staff, so we get a reflection and can look at those numbers as well.
So this is where we're going to start tag teaming now to say, okay, here's the data, but then when I'm looking building by building on a daily basis, I'm looking to see what that distribution is. And are there any schools that are seeing the hotspot kind of cases where I start to get concerned that we may not have enough staff, because each one of these cases, it's not just one day of absence, right? It's at least 5 days, and it could be longer. So that's where the building by building lens, this alone tells me the kind of the sequence of days that staff are going to need to be out, but then it translates into the staff absences that are the major concern on whether we're going to have enough staff, enough subs to be able to cover a building. And that, again, you know, in all of the priority listing of these, the staff coverage is probably what's going to be triggering any kind of temporary shifts if needed to remote, but it may only need to be for a few days. But that this translates right into that absence.
We wanted to give you some data sharing what information we had prior to COVID compared to absences that are occurring or attendance rates in the case of students as to what had happened once COVID started. So as you see, we have about 1,500 teachers, and please understand we focused only on teachers. That we do certainly have a number of other support staff that have this, but this is the person in the classroom with your students. And we found, as you can see, we did have from 1920, and we picked specific months. We did October, November, December, January, because this was prior to COVID really getting a march on us in the early 2020 school year. We wanted to go ahead and show you there was elevated teacher absence rates when you compare October of 1920, which was, as an example, 8.7%, and we had an elevation this last October to 8.93%. Please go across the board for November and December, and currently in January, and this is the last 5 days because we just came back on the 3rd, we had a 13.8% of staff teacher absent rate compared to the same time frame of January of 20 of 9.4%. Now, with 20,000 students in attendance, we wanted to compare those attendance rates as well. So we did see a decrease in our students' attendance. We have November of 19, which is 91.81, compared to November of 21, which was 87.45. So we have captured very many of our students being in attendance on a daily basis, but we also are seeing a decrease in attendance. And currently in January, for those 5 days that we have been here, we've seen a decrease in attendance as well. But be very proud of us because we have still 85 to 90%, attendance daily from our students because it's good that they are in school.
So just on this, and I'll show you one other lens or view that we have a Tableau report, which is our data analytics system, that we can look school by school, and we can look at, this is a 30-day trend, so we can look at actual numbers of days of absence and monitor to make sure, are they increasing, decreasing, are we seeing any unusual spikes that we would need to be concerned about? So when we look at the teacher absences and the students, in terms of our recommendation from Deborah and myself to the superintendent, on the top part with the teacher absences, on a school-by-school level, today, for example, we had schools that had 0 staff absences. And remember, this isn't just COVID absences. This is, any absences. We had a couple schools that had 0, and then we had a school that had 21%, okay? And that obviously, right, Mrs. McKittrick, right. That's where you start to get more concerned. If it went up to 30%, that would be a very serious level of concern. Now, when you think of the diversity of our schools and programs, that's where you have to drill down to, well, who is it that is in that building that is absent? And is it what type of staff member? Is it a classroom teacher, or is it some other support teacher that would also need a sub? You drill into, is it just a one-day absent, or are these more COVID cases? So that's where there isn't you can't use just one number that triggers anything, because we just say when you get past 20%, getting up to 30%, that's where you know that's going to be a difficult building to staff. And then I need to look at what else is happening in other schools to determine if I should, if we have enough subs across the district. So those are all the thought processes that go in place. With student attendance, when you have this kind of lens to be able to see whether it's increasing or decreasing, similarly, these are not just COVID absences, these are all absences, and across the country, school districts are reporting a higher number of absences across the country routinely all through the year, even starting back in September.
One of the most important things that we all have talked about is the ability to vaccinate our adults and then eventually our students. And for those of you who have been with us, as you remember, we did vaccine clinics for our staff members when they became available in February and March. And we were very fortunate. Large number of our staff took advantage of those, and we're very pleased to do it. What you may not be aware of is we also did COVID vaccine for eligible students at the high school level in April, followed by second shots in May. We then came back in the fall, and we, by that time, had 12-year-olds on up who could participate. So we did, during the school day, additional vaccine clinics in September and October. And we waited for bated breath for the 5-year-olds to become eligible, which they did in November. So we went ahead and scheduled those. Now those, because we needed parent consent and travel, we did those at night or on Saturdays, and we were able to participate in November, followed through December. And these are the current fully vaccinated rates for Summit County. So you can currently see that as of last Thursday's report, we have 17.7% fully vaccinated for 5 to 11-year-olds. 12 to 17-year-olds are at 50.6%. We have 18 to 64-year-olds at 69.4. 65 and above are 87.6, but the total average in Summit County is 60%. Now, obviously, we will keep working towards improving that and encouraging staff members and students to take advantage, whether it's a public clinic or something that we currently do sponsor.
So that is a snapshot of the key data points that we look at on a daily basis. Unfortunately, because of our health partners, we could text and get a team from Summit County Public Health on a call this morning in 2.3 seconds. They're that responsive to being able to sit down and talk through any data point that we're seeing or questions that we have on their dashboard that is public for everyone. We did put out, and you've seen this in a couple different, the superintendent sent it out, and then I sent it out to all staff. With our reopening team that Pat Shipe and I co-chair back in August, we sort of set procedures for these different levels of when people need to be out, when students need to be out, when staff needs to be out. How do we keep learning, continuing? And this is posted on our website as well. That in the blue highlight is what we're talking about tonight, the school level, that's in collaboration with Summit County Public Health due to extensive outbreak or staff shortages. And looking at those metrics that we just talked about and making that decision in collaboration with the county public health. At that point, if a school looked as though we couldn't staff that building, and it would be for a few days, maybe through 3 or 4 days if we're anticipating an increase, then we have a plan mapped out, and our teachers are ready because we did an instructional improvement day where they planned at the beginning of the year for the first semester to make sure they had lessons ready to go. And then we gave them time on our January in-service last Monday to kind of refresh those plans for second semester, that we would immediately go to, if Mason Elementary had to close for a few days, they would go to remote lessons the first day asynchronously to get everyone time to adjust, and then the second day would be live instruction, just like all of our families and students are used to, and they would move forward. And same thing, if anything ever happened at a district level, obviously a district level would be, a much more substantial spread, and that would most likely be something that the county is asking for, or the state, if we went back to a district level. Because again, most of the decisions now are more at a school level versus large-scale district. We just want to showcase, we're not going to go through, because you're all familiar with the mitigation efforts that we have. We just wanted to highlight a few changes we've made. Based on the data that we just reviewed, we have put in place, and some of the science that has come out, we've put some shifts in place that Deborah will just quickly mention so that we can get to questions on adjustments.
I've always, sorry about that. We already went over the vaccination clinics, so that you're already aware. As of early November, we have been very fortunate to have tests provided in our in-school clinics, so that if a student or staff member presents a symptom and it is felt to be COVID-related, in the case of a student, the nurse will call the home, ask the guardian to come and pick up the student, and provide the in-home testing materials with instructions so they can go home. And if the test comes back negative, the student can come back the next day. But if it's positive, then those instructions will be followed for isolation. We recently were offered materials through the Ohio Department of Health at the state level, and that now doesn't include surgical masks that are part of it. In fact, the most recent order is the N95, KN94 type, so those are beginning to arrive so that they are also available with the other varieties of masks we have, because we do not want a student or staff member to not get a mask that is appropriate, whether they bring it from home, they bring it in, from their parent, or they're able to get it from us. And then the last one, on top of the COVID testing home kits, we are and have been testing last winter and concluding into the fall and winter our athletes that are in contact sports such as basketball, wrestling, cheerleading, swimming, etc. And we are currently working on possible additional plans for additional testing. We did fortunately work with the vendor who gave us our testing materials for our athletes to obtain those tests that you heard us distribute to our staff members on the Sunday of New Year's weekend. It was very simple instructions. They took them home. They recorded exactly what they needed to do with the vendor and with the district, so we could make adjustments to those class areas beginning when students came back on the 4th.
So other adjustments just based on the current data and the spread that we're seeing for our field trips. We're on a 2-week cycle right now where I review those with the superintendent, and we're pulling back on some of the bigger field trips where students go out and are integrating with lots of community people. Right now we're postponing those. And then we're also, where we can, with our partner engagement, we're shifting some, like our 8th grade showcase, instead of being all together in the ballroom at one of our local event spaces, we've shifted that back to virtual just for now. And then every 2 weeks we're reviewing to see if we can relax some of that, and that every 2 weeks we'll continue to review that.
We just wanted to give you the most recent timeline as to the quarantine and isolation updates, because this is very fluid. So please be aware that the CDC came out with its newest guidelines on December 27th. Now, that was a media announcement that said it was going to be changing. When that happens, then they actually post exactly the information they want everybody to, at the state level, know about. In this case, it would be the Ohio Department of Health. They then put their guidance together and give it to the local county health departments, and then we get the information. So although it's fast and furious, there still is a method to the madness of exactly when things happen. So we got our first information from Ohio Department of Health on December 30th. And then the CDC did another switch, and we got to January 4th, and we were then given another realignment on January 7th. So these are very fluid. We will always listen carefully and monitor those CDC guidelines. We are very fortunate here in the state of Ohio that the governor, as well as the local districts around us, share the information as they get it readily. We ask each other questions, and I will be honest with you, I think we'll see another update shortly.
And finally, how does this translate and get communicated to families? That has been a major priority of this board, to make sure that we are out front and being much more transparent about our decision making and notifications to families. So the shift of any of that temporary transition to remote or notifications of event closures and things like that, it really is very similar to a snow day in terms of the tools that we use, the all calls, the website, the social media, the emails. Event cancellation, similar process, and then we are more regularly now going back into the rhythm of updates to our Learning 21-22 website to make sure that families have one place that they can go to on a regular basis. And then we've had our massive, major campaign for the vaccination awareness. And we have a roll-up-a-sleeve website now that's new, and major social media posts and newsletter just to get that word out about the vaccination clinics. And here's the next one coming up January 14th. I can't not say this here in a public meeting to encourage both student and staff booster shots for this clinic, 3 to 7 at North High School. And that is our update.
Thank you very much. And board members, this presentation is being made available as well for community persons who are watching along, so that they also can not only hear many of the updates that were given, but to have that printed information. Might I add that in addition to the many ways in which we're using our communication outlets here from the district level, one of the first things we know is that many families get their firsthand information from schools. And so we're also making sure that our schools are equipped with talking points, with information, so that they are your first level of communicator, but as well supported by district efforts, much like we would too when we have snow days, things of that nature, using multiple outlets to make sure the word gets out. So our goal is to remain in school, again, to the degree it is safe to do so. We're monitoring a multitude of factors and communicating, I think, very effectively with all of the resources available to us in our communities, as well as talking to peer districts. So we were quite aware coming out of the new year what every school district in Summit County was doing, as well as Cuyahoga County, and why, so that we could also make sure we were pressure testing decisions that were being made here as well. So this state of challenge has had a positive yield in that it has partnered us and networked us in ways that I think are quite productive. So let us open it up for if there are any other clarifying questions that you might have, or any finalizing comments that you might want to make.
Any questions? Dr. Hall?
So are we still on the 2 question, then we give it a whirl? Okay, all right. So I've got several. So the first question I have is related to, and I'll try to ask these in order. So when we're looking at the monitoring to inform slide here,
Yes.
the data review daily. I think it's great that we talk through some of the measures that we're considering. But my question would be, and by the way, so, part of this, so some of these questions are, questions that we get asked in the community, right? And so I don't think we're doing our jobs if we don't bring those questions here and ask them in a public setting, right? So please let that be the preamble or the preface to my comments or questions. Is there any comment that you might make about what these numbers would have to be, before we would, so for example, if the positive rate's 30.6% and then it goes to 34.2%, how high does that number have to be before we would take action? Or are we saying, listen, these are all measures we're looking at, but what we're really doing is waiting for the Summit County Public Health Department to tell us to close?
Yeah, I think that's a great question. And we have asked all of our experts that same question because it is that we're accustomed to a more specific data-driven. When you think about our first round of this, we had those red, yellow, green charts, and there were specific metrics attached to that. When we have talked through, and this has really been through this year, but especially since the increase has started with our Summit County Public Health colleagues, they when we ask that same question, they say it's not that simple. It's not a number anymore. It's a multitude of factors, and really for the districts, they're monitoring those positivity rates and the big items at the top that are not bold on that. For us, it's the impact that we're monitoring. So what is happening out in the community, then we're saying, well, how is that translating to student and staff absences, particularly staff absences? What does that look like on the ground every single day, school by school by school, and sometimes even class by class by class? And so that's where our focus has to be, and then we let the county deal with those other big metrics in terms of the county spread, the county case rate, et cetera.
Okay, great. My second question, and again, I asked that question because we get asked quite a bit, like, well, what metrics are you looking at? And where the numbers have to be, and so me as an individual, I don't have those answers at the top of my, tip of my fingers that I can just provide. So, okay, all right, I appreciate that. And then my second question is this slide here, the APS 2021 dashboard. The reason why, so you mentioned staff absences. I have a question related to that, but so looking at here, so this is public facing, right? So these numbers here, these are the exact numbers that the public will be looking at.
Yes.
Right, okay. The reason why I asked that question is because, how many students do we have in this district? Approximately 20,000, right? How many staff do we have? Approximately 4,000 staff?
Correct.
Right. So if I'm doing the math, it's not 0.7%, right?
Yeah.
I mean, 144 out of 4,000 is a little over 3%. So I say that not to nitpick or to try to embarrass somebody. I'm saying, but as an educational institution, if we can't do math, how do we expect our students to do math?
It is a really good nitpick, because as soon as we started sharing it, I went right there and said, we forgot to change that lower number.
Right.
We were showing some different full cases versus, so we forgot to change that lower number, so I apologize.
No,
but it's a good catch.
Well, because I guarantee you somebody who's watching is going to catch that. And
Absolutely.
Then that becomes a funny meme, like, they can't do math. So anyway, so looking out for all of us with that question. And then I guess the part B of that is, you mentioned staff absences. So this board authorized a resolution to help address some of the time off. How was compliance with that resolution going?
It's going well from Mrs. McVeigh's standpoint, in terms of, our teachers, and this I will tell you, of course, this only happens in the Akron Public Schools because I'm so proud of our teaching staff, but the bulk of our teachers will say, I have COVID, but I want to come back tomorrow because I don't have any symptoms. And we have to say, no, you cannot, because they want to be in the classroom. Sure. And so the new guidelines for the 5 days, the attendance that you all so graciously passed to be able to not have that count towards their sick days, I think that was spot on to be able to honor the work they're doing. And the data that we showed with the absences, you'll notice, and we see this in the daily trend, it spiked when we did all that testing. But already today, we saw a big drop-off because we're hitting that 5 days. And now Mrs. McVeigh has, they were calling right away, because the policy changed. Have you guys changed it? Now can I come back? Because it's 5 days versus 10 days because I have no symptoms, or they're getting better. So thankfully, that's the mindset of our teachers, and that's why the attendance has already started to level off.
But to clarify, they want the 10 days, they're getting the 10
Oh, sure. If they want that and they need that, and some of our staff are experiencing symptoms beyond the 5 days, but if you don't, then you're able to come back.
Roger that. All right.
Right. So the days exist there. I will say that in full transparency, we still are working through. It's been very recent that approval was made. So, and it also covered some persons who had already used personal days and needed to now apply that allowance to those days. So we're still working through making sure that everybody is afforded the coverage that the resolution reflected. So it'll be a minute before it's done for everyone. So I didn't want to present that as if, it's going great and we're done, and
Right, roger that. Okay. So I had one more, but I can wait to ask my last question.
Thank you. Any other questions? All right. Your one final question.
Okay. So
Dr.
this
Hall?
is the Derek Hall show tonight. Okay. Apologies. Thank you, colleagues, for indulging me asking all these questions. I appreciate it. So the last question I had is so perhaps on the measures in place. Perhaps the most consistent feedback I've gotten from folks, and I've seen on some of the APS Facebook sites, are parents who are commenting on their frequent hand washing. So I've seen some fairly angry posts talking about really kind of alleging that isn't happening with enough frequency, no pun intended, and sort of questioning, how do we get on a regular schedule, and that just passing around, and that the hand sanitizer thing's not being passed around as often as it maybe could be or should be in some classrooms. And so I get that this is not going to be perfect. So that's not the point of the question, but it's really around the frequent hand washing. How do we get to a place where we're reducing some of the variability in the cadence in which that occurs in some of our schools?
Yeah, just we get there from you all giving us that feedback from families, because we want, wherever we're hearing that, we want to be able to make sure that we're following up. And not just for COVID.
Right.
I keep saying this, that even our absences, this is the season when we normally have flu and winter illnesses, and the frequent hand washing is going to help for all that, the rest of that too, Ms. Autry. I'm sure you're supporting that, Ms. Nurse Autry over here. That should be a practice regardless of the state of COVID, but obviously elevated because of it right now. So we can definitely double down with our staff. We started that this past week with our principals to reinforce the magnitude of these health protocols. I think we all thought we were phasing out in the fall and it was getting better, and just naturally, I think all of us started to relax, and we're really trying to push that back. Yes. So I will definitely, highlight that frequent hand washing.
So I appreciate that. So because the question I also got was, how frequent is frequent? Is that once an hour? Is that every 2 hours? Is that 3 times a day? And so you take that kind of questioning attitude and you multiply it across all the voting staff we have, and so there's probably a great deal of variability around that. So I mean, I don't know if it's helpful to maybe come up with some direction, like some directive that everybody, hey, the minimum is this. Yeah,
we actually do have a guidance document specifically on the safety protocols with that type of cadence guidance. Okay. So we will get that out again, make sure that gets distributed to everyone and reinforced.
All right, roger that.
So thank you.
Appreciate it.
that.
Thank
Thank
you very
you.
much.
Thank you.
I did have two questions that I wanted to ask. One actually goes back to the dashboard slide, and I'm not sure if this could be if this possibly can be done. But my thought is for the staff, all staff, that includes both direct student-facing staff and non-student-facing staff. And I think it might be helpful to disaggregate that out a little bit to actually show our families the percentage of student-facing staff versus those who are not student-facing, because that might actually just give you more information. The other piece of that, if you look at the data slide that Mrs. Folk shared, with the age ranges of who's been, how many active cases or, the cases that we've seen, I think that those two things may also be helpful if you disaggregate it by middle school, high school, and elementary, because I would suspect the bulk of even the students will likely be in the high school level. And so that proportion of how you look at the data is different. And then the last thing I want to say, just wanted to make sure that we all, and I'm not a health expert, but I'm a data person. We also want to be careful about the way in which we look at data. So if I'm looking at this, and Dr. Hall is more of a healthcare person, so he probably knows more than I do. But if I'm looking at this doesn't tell me that younger people aren't getting it, or it's saying that they aren't having the same effects or symptoms to actually get tests to say that they're positive. So if we know how most viruses work, kids do spread viruses very, very, very much. So I think we just want to be careful about just saying that, because that doesn't necessarily depict the full picture. And I think that might give some of our staff in elementary school buildings maybe a false sense of what the reality is.
Yeah.
So,
Thank you for the feedback. We'll also make sure we talk across with Summit County. I
Right,
believe
these are
that
their
that's their chart. And so it's one of the things, though, we've been watching just to glean insight.
So let me comment, if I may, just quickly on this slide too, in relation to Dr. Akbar's comment. When we made the decision to close schools a year ago, you kind of had two camps, right? You had people that were like, school should be open, and people that school should be closed. And now with the masking thing, we now have you have the two camps again, right? People that believe in masks and people that believe that students should not have to wear a mask. So when I see this slide, the first thing that popped in my head when I thought about it was, and I think what you said it to accompany was, you said, students, these young kids, they don't tend to be spreaders of this disease. So the question I'm channeling here is one I've gotten asked quite a bit. Well, looking at this data here, why are my kids having to wear masks in school, right? It's look at these percentages here, right? So, and this is county data, right? So a lot of the schools in the county are not requiring masks on any kind of regular basis, right? So why are we requiring our students to wear a mask every day? That's the question I'm channeling. So, and let me just be clear, I believe in wearing masks, but I feel like I'm not doing my job if I don't channel that question for you.
Yeah, it's a great question that we all get regularly, because it is sort of the chicken and the egg argument, right? Yep. Is the data look good and look low, and especially our case rate that shows very low transmission that's happening here is because of the masks. And as soon as you remove those masks, then all of that prevention disappears that we just talked about. And I think we're seeing that with our colleagues. Governor DeWine was very, very clear in his last address that he implored schools to require masks. And he said he's not going to be able to do that at the state level, but he asked that schools do that to help with this increased spread. So Our state, wants that to happen. We see the positive results because of it, that we've been able to stay open, that we've seen our absence rates in a realm that is manageable for us to be able to keep schools open. And ultimately, we want to keep our students and our staff safe.
Yeah.
Health is probably, punches through everything, right? Mm-hmm. And so that's what we ultimately want, and the masks are the best defense for that.
Yeah, I agree. I think that's well said. Out of curiosity, are we tracking how many, so when students and staff get COVID, are we tracking or measuring how many of them end up in the hospital as a result of their infection?
We do not necessarily know,
okay,
because that is not necessarily
being shared with us, right?
Yeah. What it is. Now, Summit County certainly does hospitalization rates, as well as death rates, but we do not necessarily get that information related back to immunization.
Roger.
Yeah, that's why the bulk of the data we have to rely on Summit County Public Health, because we just share it with them, and then they gather it because they get it from different sources.
Roger that. Okay.
Thank you.
Okay, thank you very much. My second question, I'm so sorry.
Sorry.
Dr. Hall snuck right back in there. My second question has to do with the slide around the contingency plan. If temporary remote learning is needed, two things. One, I think that it might be helpful to add a row around classroom, because you mentioned in your beautiful presentation about even drilling down to classroom level and making some decisions around that. So I'm thinking if this is a public-facing document, that might be helpful.
Right.
And then secondarily, there might need to be one more slide that talks through what you talked to us about what remote would look like. Day one being asynchronous, day two being live instruction. Mm-hmm. I think that those are the type of things that our families and communities looking for.
Absolutely. I can definitely do that. It's on the document itself, and I can link that document that gives more details, but I will definitely add a slide so it's easy to see in terms of communication. The reason why I laughed when you said add the class, I had it in the document, and then I said, oh, that might be confusing for secondary students, who are just one class of algebra, but then what do they do with the other class? So then I took it off, then I put it back on. I've done that 5 or 6 times, so it made me laugh that you said put it back in. So we'll figure a way to note that, because I think it's possible, especially at elementary, that could happen.
Yeah, definitely. Thank you very much.